Hello, I'm Dr. Don Selvey. I'm a naturopathic physician at Copper Valley Medical. Welcome to Doc Talks. Today we're going to talk about mental wellness therapy. We're very pleased to announce the addition of transcranial magnetic stimulation as a service therapy in our practice. Specifically, we have acquired the Exomind device from BTL for doing transcranial magnetic stimulation. So, transcranial magnetic stimulation, or in this case, repetitive transcranial magnetic stimulation, treats a number of different conditions, including depression, obsessive compulsive disorder, anxiety, migraine headaches, binge eating, PTSD. We also treat insomnia, tremors, cognitive decline, chronic pain, and substance abuse. So what is this therapy? So transcranial magnetic stimulation has been around for a long time. Exomind is different because this is one that is going to be able to treat this non-invasive, drug-free, walk-in, walk-out procedure. It's painless, it's relaxing. Patients say that they could easily fall asleep, and some, in fact, have fallen asleep. Although Exomind is a relatively new medical device, the fact is transcranial magnetic stimulation has been around for at least 35 years. There are also about 112 published clinical studies that attest to the safety and effectiveness of this form of treatment. But to know how it works, most of us do. However, it gets pretty technical pretty quickly. This technology is going to be a stimulation of key areas of the brain that are involved in emotional regulation, cognitive function, and self-control. If you care, it is the left prefrontal cerebral cortex. By activating neural pathways, it helps restore healthy brain activity and enhances neural connectivity. The way I think of this is if you had a flat tire on your car, you took it to your favorite tire shop to get it fixed, they might put a patch on it. And if you had another flat, they might put another patch. But eventually you're going to want to get a new tire, and it's going to just be a whole lot better for you to have that new tire. Well, as we grow older, the neurons in the brain begin to degenerate. All cells in the brain have a life expectancy. That's no different with the brain. So if we expect there to be a deterioration of the neurons in the brain, why can't we just replace some of them? And the fact is, called neuroplasticity, and that's exactly what this does. It stimulates the brain to make new neurons, and that's how it is that we get a little bit healthier if we've had some deterioration from environmental causes, from diseases, from tissue damage. This is going to make that better. In some of the older forms of transcranial magnetic stimulation, they do therapy 5 or 6 sessions a day, 5 or 6 days a week, which means for all intents and purposes, somebody has to be an inpatient in a mental health facility. This is different. We are doing one session per week for about 6 weeks. Each session lasts about 24 and a half minutes. And you are relaxed, you are fully dressed, there's no drug, there's no anesthesia. After the session, you can resume normal activities immediately. There might be a slight headache in some people, but typically even that would resolve within a matter of a couple of minutes. There's a risk with every procedure and every medication. Generally, repetitive TMS is pretty well tolerated. However, in some patients, it may cause a headache. Some patients say that their scalp kind of tingled. I don't know that that really qualifies as pain. If a patient has a history of seizure, they could in fact have a seizure because of this. So with any medical procedure, there's some risks associated with exobiome therapy, and you need to discuss that risk with us when you come in for evaluation or treatment. Some patients should not be treated with TMS. The principal contraindication is if they have some metal in the head, the neck, or the upper chest that would respond to a magnet. Most metal implants now are not ferromagnetic. They might be titanium or something of that nature. But older implants, coils, stents, vasostimulators, even some of the old ocular implants may have some metal in them. But if in doubt, please check with the surgeon who did your surgery and see if it is ferromagnetic or if it is titanium. Of course, patients with a history of seizure disorder should probably either wait or consult with their neurologist before they begin treatment. There are some current studies that are evaluating risks and benefits of repetitive TMS to treat epilepsy, so there is some hope. But if you have a history of seizure disorder, we'd want you to talk to the neurologist first. If you'd like to know more about the Exomind and transcranial magnetic stimulation, call us. Come in, make an appointment. We'll do a no-charge assessment, even a brief demonstration of the device so that you can experience it before you try to buy any sessions with it. As with every one of our Doc Talk sessions, this is information intended to educate you about a service that we offer. I'm not trying to diagnose, treat, cure, mitigate against any particular condition that you may have. I am not trying to take you away from your current practitioners. If you have a question and you're not getting the information or the treatment that you need, please come talk to us. Dr. Don Selby. I'm with Copper Valley Medical, www.coppervalleymedical.com or info@coppervalleymedical.com. Thank you for listening.